my name is Lydia Tran. I'm a nurse practitioner student at FDU, and I'm here to perform your physical assessment. Can you tell me your name?
Joseph Trent.
And then what's your date of birth?
September 5th, 1974.
And how do you want to be addressed?
Joe.
Okay, so hi Joe. So do you know the date today?
Sure. It's August 2nd, 2020.
And do you know where you are?
Yeah, I'm in the clinic.
And what made you come today?
I came for a health assessment.
Okay, so basing on the patient's answers, Joe is alert and oriented to person, place, time, and situation. He's also, he looks well groomed. He doesn't smell. He's dressed according to the season. He sits upright. He has a calm demeanor. So everything is normal. Joe, before we start, I have to wash my hands. Granting, I already washed my hands. And now I'm ready to check your vital signs. So vital signs includes the blood pressure, the heart rate, respiratory rate, and temperature, and the pain scale. So are you in pain right now?
No.
So Joe is on no pain, so 0/10 in the pain scale. I am also going to check his weight and the height and check the BMI. Okay, so I want you to stand up so we could look at the Snellen chart.
Sure.
Test your vision.
Sure.
And are you wearing corrective lenses?
No.
No. Okay, so Joe is 20 feet away of the Snellen chart. I want you to cover one eye and read the smallest line that you could see.
Sure. It's DEFPOTEC.
Okay, very good. You could take a seat. So, basing on the result of the examination, his vision is 20/20, meaning he could see in 20 feet what a patient with a person with a normal vision could see in 20 feet. With demonstration purposes, I'm only going to show you one eye, but we will do it in the other eye covered, and then with both eyes uncovered. Okay, so now, Joe, I'm going to tell you 3 words that I would want you to remember. Okay, these are car, house, and pool.
Car, house, and pool.
Okay, so these 3 words, I'm going to ask you again after the examination. Okay, so we will start off with checking the head. The head is normal cephalic, it's symmetrical, it's upright. And on vision, on inspection, there is no visible masses or lesion. On palpation, is it painful when I do this?
No.
Okay, no pain on palpation. Looking at the hair distribution, it's normal. There are no bald spots. There is no infestation. I could see some gray hairs. And no discharges or open wound. Looking at the face is symmetrical. And there is no edema, it's symmetrical, there's no ptosis, there is no abnormal movements or tremors on the face. And there is equal hair distribution, the patient is well groomed, although I could see some gray hair, facial hairs. And I want you to raise your eyebrow, close your eyes, frown, smile, and then puff out your cheek, and then clench your teeth. Okay, so cranial nerve number 5 and cranial nerve number 7 is intact. Now, I want you to close your eyes and tell me if you feel this.
Yes. Yes.
Okay, so the sensory part of cranial nerve number 5 is also intact. Now, Now checking the temporal artery, it is elastic and smooth, which is normal. Locating the temporomandibular joint, can you open your mouth? Close it, move it side to side. Is it painful when I do that?
No.
Okay, so the temporomandibular joint, the range of motion is normal, and there is no crepitus, no edema, no pain. Now, let's move on to checking the external structures of the eye. So far, the eye is symmetric bilaterally, and there is no excessive lacrimation, there is no redness, there is no jaundice, and there are no eye discharges. Can you look up, please? Okay, the conjunctiva is pink and moist, there is no redness. Looking at the sclera, it is white and moist and smooth, so there is no jaundice, and the eyelids there is no edema on the eyelids, and there is no nystagmus. Are you seeing double?
No.
And no diplopia. Okay, I want you to cover one eye. Okay, and take it out. Okay, so good. So there is no nystagmus, as I've said earlier. And now I want you to cover one eye again and tell me if you see my fingers, okay?
Yes. Yes. Yes.
Okay. So the peripheral vision is intact, and now I'm gonna check the external ocular ocular movement. Okay. So look at my pen light. I want you to follow the gaze. Okay. The 6 cardinal gazes is intact. So the cranial nerve number 2. The optic nerve is intact, cranial nerve number 3, number 4, and number 6 is also intact. Well, I'm gonna dim the light and then I'm gonna check your pupils. So far, looking at your pupils, they are both symmetric. And can you please stare at the wall? Okay, very good. So both pupils are equally round and reactive to light. Can you stare at it, please? Okay. So both pupils are equally round, reactive to light and accommodation. Now moving on, I'm gonna check your eye by using by the use of an ophthalmoscope. Okay, this is checking the internal structure of the eye. Okay, stare on the wall. Okay. Red reflex is easily visible. The optic disc, the red reflex is easily visible with clear borders. The optic disc is round with sharp edges. There is no, the AV ratio is 2:3. There is no cataract. There is no there's no cataract, so everything is normal. We're gonna perform the same on the other eye. Now I'm gonna check your ear. Looking at the external structure of your ear is normal because it's symmetric bilaterally. Looking at on the side, on palpation, there is no palpable masses, there are no lesions. There is no ear discharges, at the same time there is no odor. Now I'm gonna look into the internal ear structure with the use of an otoscope. Looking at the inside of your ear, the ear canal is smooth. At the same time, it's smooth and it's pinkish. There is without nodules. Your tympanic membrane is pearly gray, shiny, smooth. It's translucent without bulging. Okay, now I'm gonna check your acoustic nerve by using the whisper test. I want you to cover one ear and I'm gonna whisper something.
5, 6, 7.
Very good. Now with the use of a tuning fork, I want you to tell me if you could hear the sound bilaterally in both ears, okay? This is what we call the Weber test.
Yes.
Okay, very good. So the acoustic nerve is intact. Now looking at your nose, the nose is symmetric, your nares are open, and there is no nasal deviation of the nasal septum. And can you breathe in and out freely?
Yeah.
Okay. Good. I want you to close your eyes. This is testing the olfactory nerve. Can you smell this?
Yes.
What is it?
Lavender.
Okay, very good. So the olfactory nerve is intact. Now moving on, I'm gonna go check your mouth. So looking at your lips is pink and smooth and moist. Can you please open your mouth? Okay. On inspection, can you please say ah? Okay, very good. On inspection, the buccal mucosa is pink and smooth. There are no lesions. When Joe said ah, the uvula rises, the soft palate also rises. So it means that the vagus nerve and the glossopharyngeal nerve is intact. Now I'm gonna check your gag reflex. Okay. At the same time, I will also palpate your tongue. Okay. Okay. Gag reflex is intact. And now palpating your tongue. Okay, is it painful?
No.
No lesions, no nodules, everything is good. Tonsils is +1, there is no postnasal drip. And can you please stick your tongue out and then put it back in, put pressure on the cheek and then the other side. Okay, so good tongue control, tongue is midline, so it means that your hypoglossal nerve is intact. Now let's move on to your neck. Looking at your neck is symmetrical. There is no visible lesions, there are no open wound. Let me and you have also good good head control. Checking the trachea is midline. Now I'm gonna check your thyroid. Can you please swallow? Okay, so there is no thyromegaly and the thyroid is movable. And now let's move on to checking your carotid artery. I want you to checking the carotid artery, do it one at a time. Okay, there is +2 palpable pulsation. Now I want you to hold your breath, to breathe in and hold. Okay, very good. So there's no bruise. Now let me palpate your lymph nodes, starting with the preauricular, postauricular, tonsillar, submandibular, submental, posterior cervical, deep cervical chain, and then supraclavicular. Is it painful when you do that?
No.
Okay, so the lymph nodes are non-palpable and there is no tenderness. Now let's move on to assessing your upper extremity. Oh, before I do that, I want you to check the range of motion. Can you please put your chin to your chest, and then your ears to your shoulder, and then do it on the other side, and then we'll look up to the ceiling. Very good. Look down. So the range of motion is good. Can you please put pressure on my hand? Okay, the other side. Okay. Okay, shrug your shoulder against my resistance. Okay, very good. So the spinal accessory nerve is also intact. Now looking at your upper extremities, checking your hand. So for demonstration purposes, I'm just gonna do one hand. We'll do the same on the other side, okay? So looking at your hands, your arms, the skin is intact and it's smooth. There is no discoloration. And let me palpate the pulses, radial, ulnar, and the brachial. So all the pulses are normal, which is +2. Now I'm gonna check your different reflexes, starting with the brachial reflex. Okay. Okay, just relax. Okay, very good. So there is contraction of the biceps. Next, triceps. Okay, just relax. Okay, very good. So that's +2. There is contractions of the triceps. Next, the brachioradialis, which is like 2 centimeters from here. Okay, so here's some C5 to C6 is intact, and C5 to C6 of the cranial of the spinal root is intact. Now I want you to bend your hand up through the wrist and put it down, bend it down, good. And then I want you to spread your fingers and then close into a fist. Okay, then open and then touch your touch your fingers with your thumb. Okay, and then touch the ball of your pinky through your thumb. So very good. Okay, so the range of motion is normal. Palpating your joints, is it painful when I do that?
No.
Okay, so there is no pain on palpation. Okay, I want you to do this. Okay, okay, push my hands. Okay, good, and then push it back. Okay, very good. And then against resistance. So the range of motion is +5. Yes, good control. Okay, Next, I want you to do rapid alternating hand movements. So with palms down and put it up and down, up, down, very good. And now tell me if you feel a sharp or dull sensation. Close your eyes, okay?
Oh, sharp. Dull.
Okay.
Sharp.
Okay. I'm gonna touch your fingers and tell me which one that I touch, okay?
Sure. Pinky.
Okay.
Thumb.
Okay, very good. And now checking your capillary reflex. Capillary reflex is less than 3 seconds. Okay, now let's move on to checking your chest. You could take your shirt off. Okay, looking at his anterior and posterior chest, the AP diameter is less than the transverse diameter, which is normal. He's not barrel chested. We'll start off checking the posterior chest. During inspection, the skin is normal. At the level T9 or T10, and level T9, T10. Okay, let's do chest expansion. Inhale, exhale. So there is bilateral chest expansion, and then next I'm just gonna palpate. There is no visible mass or lesions, and then starting from the apices to the base of the lungs, I'm gonna do the percussion. Okay, so no. Before we percuss, let's do tactile firmitus. Can you please say 99? Okay.
Okay. 99. 99. 99. 99.
Okay, so symmetrical vibrations on both sides. Next, I'm gonna percuss on both sides. We'll do the same on the other side. And from there, we do like a ladder. Okay, so all lung fields are resonance, and then at the same now, I'm gonna check for the pain. Tell me if there is pain, okay?
Okay. No. No.
Okay, the costovertebral angle is non-tender, so the kidneys are normal. So now I'm gonna auscultate where we discuss or the lung field. Breathe in. Out. So we'll do this in a ladder fashion, comparing from one side to another. Okay. So from C7 to like T10 to the 7th or 8th rib. Okay, so his lung sounds are clear. All lung sounds are clear. No adventitious sounds. No moving forward. Okay. And the anterior chest, we can see upon inspection that there is a presence of a keloid, and there is no use of accessory muscles while breathing. So we're gonna do the same. I'm gonna percuss. I'm gonna do the tactile firmitus on the anterior chest. Say 99.
99. 99. 99. 99.
Okay, so symmetric tactile firmitus vibrations on both sides, which is normal. And then we're gonna percuss starting from the supraclavicular area until the the base of the lungs. Okay. So far, everything is normal. There is like resonance in all the lung fields. And then I'm gonna do bilateral chest expansion. Inhale, exhale. Okay, very good. So there is symmetrical bilateral chest expansion. Moving on to auscultation. Inhale, exhale. Okay, all lungs fields are normal. There is no presence of adventitious sounds or any breathing. I want you to go in the bed, please.
Sure.
Okay, Now I will check your jugular vein distension by the use of a ruler. You are the jaw is 30 degrees. Okay. So the internal jugular vein pressure is 2 centimeters. 2 centimeters at sternal border at a 30-degree angle. And now I'm gonna check your the apical pulse. So I want you to breathe in and hold. Okay, very good. You could breathe out now. And next I'm gonna palpate the different there is no vibrations, there are no thrills, no visible pulsations. Now I'm gonna move on to auscultating the different cardiac landmarks, starting with the right centrocostal space, which is the aortic, then pulmonic, then the herbs point, the tricuspid, and the mitral. First, we'll start with the bell of the diaphragm of the stethoscope, and then we'll do it the same time with the bell of the stethoscope. Okay, the same cardiac landmarks. So far there's no presence of any murmurs or bruit, and then we will gonna check the whole of the heart rate on the apical side. I want you to go to the side. Okay, so you're gonna do that for a whole minute. So the normal is like around 60 to 80 beats per minute. Now moving on to the abdomen. Looking at the abdomen is the skin is smooth. There is no discoloration. It's round. There is no presence of hernia. Now let's move on to auscultation, starting from the right lower quadrant, doing a clockwise motion. So the normal vowel sounds is around 40 to 30 vowel sounds in a minute. Okay, now I'm going to check for the venous arteries, starting off with the aortic, then the renal, the iliac, and the femoral. So far there is no signs of any like bruise. Okay, next I'm gonna do like percussion. I'm gonna do percussion. Also there is tympani on the hollow side, and there is dullness on where the organs are. Now do light palpation, checking there is no hepatomegaly. Deep palpation. Is it painful when I do this?
No.
Okay. So there is no pain. There's no hepatomegaly, and the spleen is not palpable. There is no masses, and there are no lesions. There are no rigid areas of the abdomen. Now let's move on to the lower extremity. So looking at the lower extremity, it's equal hair distribution, no presence of edema, good capillary refill, less than 3 seconds. Is it painful? Your joints are painful? No. So we'll do the same on the other leg, and checking for the pulses, the popliteal, dorsalis pedis, the femoral, and the the femoral, and then the posterior tibial. Okay, your leg up. Very good. Down. Okay. I want you to do this. Okay. There's a good range of motion on the leg. Good job. Okay. Can you please do the heel to shin from with the use of your heel? Okay, slide it down to your shin. Very good. Good heel to shin, meaning good cerebral function. Let me know if you feel this, okay? Is it sharp or dull?
Sharp. Sharp.
Where is this at? You know.
My thumb. My big toe.
Okay, very good.
Dull. Dull. Dull.
Okay, so good sensation on both legs. You could come right here. Let's check for your deep tendon reflexes to to start off with the patellar reflex in the knee. This is to check your lumbar. Okay, very good. So there, that's +2, and going to your Achilles by dorsiflexing your foot, hitting the Achilles tendon. Okay, very good. So your S1 or the spinal root, nerve root is intact. Now, can you please stand up? Let me check your spine. Can you please bend and touch your toes? Okay, there is no good spinal curvature, and there's no kyphosis or lordosis. Okay, I want you to walk over there. There is good gait, steady gait, and now I want you to heel to toe, walk from heel to toe. Okay, good gait, able to follow instructions. Now I want you to hop with one leg up. Okay, and now close your eyes. And then this is a Roomberg test, and we'll do 20 seconds. So far, the Roomberg test is normal. You could take a seat. And now, Joe, tell me, no. Before that, let me check your rhapesthesia, and at the same time, sternocleidosis. Close your eyes. Tell me what's in your
Coin.
coin. Very good. And we'll do on the other side. And tell me what letter this is, okay?
Sure. L.
Okay, very good. And you do the other side. And to end the examination, tell me the 3 words that I asked you to remember earlier.
House, car, and pool.
Okay, very good. And that concludes our physical examination. Okay, thank you.
Thank you.
Okay, bye.